Hello everyone and welcome to another video of reviewhealthcare.org. In this video I'll be comparing in-depth details about Medishare and Christian Healthcare Ministries. I'll be comparing their pricing, deductibles, qualifying amounts, pre-existing conditions. I will show you medical event examples, what is covered and what is not, and I'll answer some of the most common frequently asked questions for you in this video. Please note that this is not a paid promotion. I do not get paid from YouTube or any of the companies mentioned in this video. Christian Healthcare Ministries and Medishare are non-profit organizations and they are the leaders in health sharing ministries. Both have shown to be reputable and have financial stability, unlike many of the newer health sharing companies out there. They actually work pretty similar like commercial health insurance with some exceptions. You pay a monthly premium and the sharing ministries use that money to share among the members in need after they meet a certain deductible. You save lots of money with these health sharing ministries, but you do have to meet a minimum amount and or a deductible before they pay or reimburse you. I am comparing the best plan from Medishare, their AHP 3000 plan, to Christian Healthcare Ministries Gold plan with CHM Plus, formerly called Brothers Keepers. The pricing shown is for a 45-year-old person in the first year. Medishare offers a discount for the first year at the time of this video. In the first year, you will pay $310 per month. However, in the second year and from there on, it's $420 per month. I will give you pricing for other age groups in a few moments. As a side note, Medishare's premium is age and zip code related, so drop me a comment below with your zip code and age group and I will let you know your pricing. Your deductible will be $3,000 with this plan. This is the amount you have to meet before the plan will pay. It's important to note that Medishare is the only plan which has an additional $99 fee for a health coach, which will be automatically signed to you if you do not meet Medishare's health criteria. Medishare bases this on your weight, cholesterol, blood pressure, pre-existing conditions, and some other criteria which is vaguely described in their terms and conditions. This $99 fee is not included in the premiums listed here. Once you're considered healthy by Medishare, this fee will be waived. Medishare does have a network of doctors and facilities you have to stick to. However, you can go out of network, but it will cost you. With Christian Healthcare Ministry, you do get the freedom to go to whatever doctor or medical facility you like. Medishare does not have any coverage for pre-existing conditions for 3 full years. After 3 years, you will get limited coverage for pre-existing conditions. I'll go into detail about pre-existing conditions a little later in this video. Let me show you the details about Christian Healthcare Ministries, or CHM for short. We are comparing the best Medishare plan to the best plan of Christian Healthcare Ministries. This is the CHM Gold plan with CHM Plus included. This CHM Plus used to be called Brothers Keepers. It's an addition that covers an unlimited dollar amount per medical event instead of $125,000 per medical event. This additional fee is included in the amounts listed here. Christian Healthcare Ministries has set pricing for their plans, regardless of your age, your zip code, or your health status. The price for the Gold plan, including CHM Plus, is $267 as of January 1st, 2024. The price maxes out at 3 persons in your household. So if your household is a family of 3, 4, 5, or even more persons, you only pay for 3 persons at the most. Your deductible, or personal responsibility, PR, as they call it, is $1,000 per person per year. There's also a minimum qualifying amount you have to meet before you can submit any bills to Christian Healthcare Ministries. This is $1,000. I know this might sound a bit confusing, so I'll give you some detailed examples in just a few moments. Christian Healthcare Ministries has no additional or hidden fees besides the optional CHM Plus. But as I mentioned before, I included the CHM Plus in the pricing listed here. There are no network restrictions with CHM. You can go to any licensed doctor, specialist, emergency room, or medical facility you like. With CHM's Gold Plan, you have coverage for pre-existing conditions as soon as you enroll, so there's no wait time for pre-existing conditions. However, there are limitations, but they are so much better than the ones with Medishare. I'll go into detail about pre-existing condition coverage next, after I show you the pricing for some different age groups. Comment below and I'll give you your personalized pricing for both Medishare and Christian Healthcare Ministries. Let's talk about pre-existing conditions. A pre-existing condition is a medical condition for which members experience signs, symptoms, testing, or treatment before joining. With Medishare, you have to wait 3 years before your pre-existing conditions are partially covered. Between the 4th and the 5th year, you have $100,000 available for pre-existing conditions. And after the 5th year, you'll get $500,000 per year on pre-existing conditions. Let's look at Christian Healthcare Ministries. CHM defines pre-existing conditions in 2 categories: maintained pre-existing conditions and active pre-existing conditions. Maintained pre-existing conditions have immediate coverage. Maintained is defined as follows. You have 90 days without undergoing testing or treatment. You need no further testing or treatment. And your medical records show that you are cured or on a maintenance treatment regimen. CHM has 2 programs for people with maintained pre-existing conditions. One is their Gold Plan schedule, which gives you the following coverage. In the first year, you get $15,000 coverage. In the second year, you get an additional $10,000 coverage. And in the third year, you get an additional $25,000 coverage. After the third year, your pre-existing condition is no longer considered as pre-existing. And at this point, you have an unlimited coverage amount for your pre-existing conditions if you have the Gold Plan with CHM Plus. So I have many people asking me, what happens if in the first 3 years you have a claim for a pre-existing condition and the amount is more than what CHM covers for pre-existing conditions? Well, that's where the second program comes in. The total bills covered for pre-existing conditions can be added to a special program called the Prayer Page, which is listed in their monthly magazine called Heartfelt. Many members will donate to other members in need to help with your medical bills for pre-existing conditions after the coverage of the Gold Plan. So if you have a medical event costing over $15,000 in the first year or $25,000 in the second year, you can opt to be considered for the Prayer Page in the monthly Heartfelt magazine. I read their magazine and time after time people are getting most, if not all, bills paid by donation of other members. CHM is a large organization since the early 1980s, and their magazine states that if members pay $15 to $20 per month, if they donate, I should say, $15 to $20 per month, it would cover every person's bill on the Prayer Page. In the month of September of 2023, the total amount needed was $338,000 to cover everyone's maintained pre-existing condition. The giving for that month was over $313,000, so there was only a very small percentage what was not covered for that month. So if you have any pre-existing conditions, CHM is definitely a better option for you compared to Medishare. If you have signs or symptoms right now before you join CHM and or the conditions need testing or treatment, or you already have started treatment, Other than regular maintenance routine medication, you have no coverage, unfortunately. If you have any questions about that, drop me a comment below and I can definitely explain it more into detail. What is a medical event? A medical event are all bills added together for this one particular illness, disease, injury, or medical condition you may experience. From the first doctor's visit, medication, medical testing, to the last follow-up visit, all the charges for that is a medical event. A medical event continues until one of the following statements applied. You are cured or healed, treatment is now at routine maintenance level, or you are 90 days without any kind of testing or treatment and no further testing or treatment is needed. If you have treatments over 90 days from the last event, Christian Healthcare Ministries will consider this as a new medical event. A medical event may include some or all of the following items. If the total cost for a medical event adds up to be $1,000 or more, you can file a claim to CHM. Let's be honest, $1,000 in medical expenses is easy to reach with the cost of healthcare these days. Let's show you some examples on how Christian Healthcare Ministry works in a medical event. In January, you go to the doctor for pain. The doctor orders an ultrasound, CT scan, and lab work. You also will have a follow-up visit. The total expenses for this medical event are $1,550. As mentioned earlier, CHM has a qualifying amount to be met before you can submit your bill. This is per medical event, so in this case, your bill adds up to be over $1,000. So this means you can submit your bill to Christian Healthcare Ministries. You have a $1,000 personal responsibility, so your total reimbursement from Christian Healthcare Ministries will be $550. This PR or deductible is one of the lowest in the industry. Most commercial plans have a $3,000 to $10,000 deductible. Medishare has a $3,000 deductible, so this is a big savings with Christian Healthcare Ministries. Here's example number 2. In the same year, you go to the doctor for a routine checkup. The doctor wants to do a colonoscopy and an endoscopy as preventative health care. Your total expenses are $2,250. Your qualifying amount is $1,000, which you exceed, so you can send the bills over to Christian Healthcare Ministries. Your personal responsibility has been met in the previous example, so you have no deductible. In this case, Christian Healthcare Ministries will reimburse you the full $2,250. If you follow our channel, you get access to our other videos. There is a great video out there where I'll compare Medishare, Christian Healthcare Ministries, and commercial insurance pricing. This is a mind-blowing video to see the different pricing and the savings, even when you have a chronic illness or if you need surgery. Here's a non-exhaustive list of items what's covered with Medishare and CHM. Here's a list of items which are not covered by Medishare or Christian Healthcare Ministries. I have some great tips and tricks to cover for these expenses listed on my website. I will answer 4 of the most frequently asked questions I'll get about Medishare and Christian Healthcare Ministries. Does Medishare and Christian Healthcare Ministry cover medications? Both of them do cover medication if you have a medical event or incident, and 3 to 6 months thereafter. Christian Healthcare Ministries could pay longer for your medication if there is a curable plan in place. For example, if you have been diagnosed with cancer and you need to take 6 to 12 months of medication, Christian Healthcare Ministries would look at your medical records and likely approve that medication. Both of them do not cover regular routine medication unless related to a medical event. So how do I pay for medicine not covered by Medishare or Christian Healthcare Ministries? As a routine medication is not covered, we at reviewhealthcare.org did in-depth research to give you some of the best tips out there. Tip number 1. Prescription of hope. If Medishare or Christian Healthcare Ministries does not cover your routine medication, then you can try this alternative program. If you are in need of expensive medication between $100 and $2,000 or even more, you can get this for only $50 per medication for a 30-day supply. This is not a discount plan. It's called Prescription Hope, and it's for the more expensive FDA-approved brand name drugs. Prescription Hope can get a brand name drug that is $1,000 retail for only $50. You have to apply, but most individuals are approved. Here's a screenshot of their website regarding the approval. Please note that Prescription Hope is a service. You likely can apply with the manufacturer website yourself and get approved for low to no cost medication. What does it mean that I am self-pay? Because Medishare and Christian Healthcare Ministries are technically not health insurance, you are considered self-pay. It sounds a little scary, but it's really not. All it means is that you state that you're self-pay when you visit the doctor or a medical facility. Most doctors' offices and medical facilities, like the emergency room and hospital, have a self-pay fee schedule in place. Because they don't have to bill your insurance or have to deal with your insurance, they typically save you a lot of money. You then can choose to pay in full or just ask for a payment plan if the bill is too high. My personal experience is that this is not an issue at all, especially when you explain that you have Medishare or Christian Healthcare Ministries as a backup. Most medical facilities already know what this is. With Christian Healthcare Ministries, once you submit your bills for a medical event, you have to wait 60 to 90 days to get reimbursed. Christian Healthcare Ministries will send you a check directly to you, so you can pay the remaining balance to the providers or pay yourself back for what you paid up front. With Medishare, your in-network doctor will bill for you after collecting a $35 copay, but you still will be expected to pay the remainder after your negotiated discount. Are doctor's visits covered? Yes and no. Both Medishare and Christian Healthcare Ministries have an app so you can speak directly to a licensed doctor online. The doctor can prescribe medication if needed. There is no charge for using these services, and you can use them as many times as you need. If you need to see a doctor in person, then Medishare has a network of doctors for you to go to. If you go to the in-network doctor, you pay a $35 fee, which is only a down payment for your total bill. If your bill exceeds your annual household portion or deductible, then Medishare will reimburse you the difference. Otherwise, the total will be applied to your deductible, and you're responsible for the remainder of the bill. Christian Healthcare Ministries covers any medical event within their guidelines when the total bills for a medical event add up to be $1,000 or more. So if you go to the doctor and you have to pay $80 out of pocket, your bill will not be covered. With Christian Healthcare Ministries, you save hundreds of dollars per month on their premiums versus commercial health insurance. So my advice is that you put a little money into savings each month so you can pay for a doctor's visit when needed. If you go to the doctor and it turns into a medical event or illness, and all the bills for this medical event, including testing, medication, and follow-up, adds up to be over $1,000, then you can submit your claim to Christian Healthcare Ministries. I gave examples earlier in this video on how this works. I realize you may have many questions about coverage and what exactly these health insurance alternative plans are. Drop me a comment below or visit my website, reviewhealthcare.org, to get the most of these questions answered. You also have the opportunity to contact me directly through my website. Thanks again for watching, and I'll see you in the next video. Have a blessed week.